Hello, and thank you for joining us today. I'm Sarah Lewis, and I started this venture as a way to inform mommies everywhere on a variety of topics that are impacting our daily lives. Right now, we are all overwhelmed and consumed by the sudden changes brought on by the COVID-19 coronavirus that has upended our personal and professional lives. There are many questions and concerns that are yet to be answered, but together we can work to find the best information and share with each other. Today, I have a special guest, Conni Young, a registered nurse and certified lactation consultant. She serves as a post-delivery nurse at local hospitals in South Carolina. And today she will share with us what it's like for moms that are pregnant, trying to get pregnant, soon to deliver, and post-delivery experiences. And she will share well-researched and experienced information with us so we can go behind the scenes with our frontline hospital workers in hopes that we can prepare ourselves for the current crisis unfolding and make better informed decisions. Some of you may know that I am 7 months pregnant already, and this information is vital to me and my family. But this is also important information for all of us, those friends and family in our lives that are pregnant or that are trying to conceive are at risk, and it's good information for us to know. So let's go ahead and bring in Conni. Hey, Conni.
Hi.
Thank you for joining us. Well, first, before we get started, you're a mom also.
I am.
And
I
tell
am.
us about your family.
I have two kids, an 11-year-old girl. She's in the 6th grade, and a 4-year-old boy who is in preschool or was. Or that.
Yeah. And
Yeah.
this changed your life a lot.
Yeah.
And tell us again the shifts that you work. You had mentioned, I know you're working a lot right now.
Yeah. So I work 3 12-hour shifts at one hospital here in town, and then I work PRN or as needed at our hospital, and it's typically an 8-hour shift every week or every other week, just depending on what their needs are.
And you work exclusively post-delivery nurse, right? With delivering babies, correct?
Right. Postpartum, mother, baby, however you want to call it. Some hospitals have a cute little name for it, but it's basically postpartum couplet care. So moms and babies in the room.
And how long have you been in the field?
So nursing was a second career for me. I went back after I had my first baby. So I've been nursing close to 7 years.
And you probably never experienced anything like what we're going through right now with the COVID-19 pandemic. This is
No, I don't think anyone has. Nobody that's alive anyway, I don't think. I don't know.
Well, thank you for joining us. I'm just going to go through a series of questions that I think a lot of moms, even people considering conceiving, are asking themselves. What are things like right now on the front line? What could they be like in a few months? Of course, with our best research that we have right now, the best knowledge we have right now. And then what could it be like, if there really is a rumored baby boom 9 months from now while people are stuck at home? What that could look like. So the first question I think a lot of people ask are, as a pregnant person, are you at risk, more at risk to contract the COVID-19?
So I want to preface everything that I say here by saying that I've done lots of research on this, and I've use several evidence-based resources, but the information is changing every moment, every day. So the best thing to do if you have specific questions or specific concerns is to contact your healthcare provider, your OB, your midwife, whomever is providing that care for you, because there are new recommendations every day. So I know what we know today, but that can all change So you asked about pregnant women being more susceptible to COVID, and any pregnant woman, because of the changes that we experience in our body, we're thought to be more at risk for illness and infection. We don't really know if pregnant women have a greater chance of getting sick from COVID as a result of the virus, compared to their non-pregnant peers. But, just as you would go to any great lengths to protect yourself from any illness during pregnancy, you should do the same for this. Wash your hands properly. So not just a quick little scrub and rinse, but like at least 20 seconds, and try to avoid touching your face.
That's a great point. As you said, daily reading the CDC guidelines and information that you're getting, expert resources, I'm sure that does change. And obviously for every individual pregnant person to contact their health provider. That's a great point before you make any, big decisions. Next question I think many women have is, how might the coronavirus affect your pregnancy? At least with what we know or think right now.
So we're not really sure. Generally speaking, high fevers in the first trimester can increase the risk of certain birth defects. Miscarriage and stillbirth have been known to occur with other coronaviruses. There are several different ones. This is a new coronavirus. And flu, and adverse outcomes like premature birth have been reported among babies born to mothers with COVID, but they don't really know if it is related.
So, because I know we've all probably read the articles in different countries, there are definitely babies that have contracted it, but you're right, it's very nuanced right now. We're not really sure. Obviously,
and it's hard to say, like, how much research are they putting into, since it's such a small population so far of pregnant people with it, how much effort and research are they putting into that population in that research? I don't know.
Well, I guess that kind of segues to the next question, which and we kind of briefly touched, is, could someone transmit the coronavirus to their baby during delivery if they
yeah, so there's some data to suggest that it might be possible, and again, that that information is constantly being updated, so it's really, again, just, there's no definite answer to that, but I will say, and this is an important part, there's currently no evidence that the virus appears in amniotic fluid or breast milk. So I think that's really important.
That's wonderful news. Definitely, because I think most women, they at least try to breastfeed if they're able to. And I can't imagine not being able to do that if you thought that you were going to pass it on to your baby. How frightening that would be if you had contracted the virus.
Right.
So, well, and then the next question would be, is it safe to deliver at a hospital where there have been COVID-19 patients?
Sure. So we are working really, really hard to maintain a safe place to deliver your baby and to recover. Locally, I'm not aware of any pregnant women with COVID delivering, but should one be present, we're prepared. We're trying not to mix, COVID moms with non-COVID moms. They're, every unit has a negative pressure room, which is ideally where they would like to have COVID positive moms, but they're only using the ones on our unit as a very, 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 very last resort. So they're going other places before they come to us.
That's great. I mean, that's a great point as well. Well, another concern that a lot of people have had, I know I certainly have, or so I'm due in June, so I've got a little bit of time, but people that are due right now, what plans should an expecting mother make if the hospital system does become overwhelmed? And of course, that's different for every area of the country. You know, you see New York is really getting hit pretty hard. South Carolina, you know, doesn't have as many cases. So, you know, it's kind of a broad question, I guess. But, you know, what it could happen, the system could get overwhelmed unexpectedly. So I guess what are you seeing, or what would you know, respond to as
Yeah.
far as how someone would handle that?
So like I said, you know, they are not currently commingling COVID patients with non-COVID patients on our unit. You know, we still have plenty of PPE and masks and, you know, very strict measures that we're taking where we do have COVID patients. So there shouldn't be any cross-contamination. They're really trying to make sure that whomever is caring for those patients isn't caring for other patients without it. Those kinds of things to make sure that we don't spread it to other people.
A question that some people have: what if your OB that you've been working with, who's supposed to deliver your baby, they contract COVID-19?
I feel confident that they would be taken out of the rotation in their practice until they were fully recovered. I would think that would be the case, and you would just see someone else in the practice, hopefully someone that you're familiar with, not a totally new face. I don't think there are many practices now, at least locally, that just have one physician. It might be different if you have a midwife or planning a home birth, but
Yeah,
most practices have multiple doctors, and I would think that you would just see someone else in the practice.
I'll say from the practice that I go to, they do rotate. We see several physicians before they, you know, make delivery plans, which is good. So you feel comfortable with a variety of doctors. And even this week, I was supposed to have a wellness visit, and they said unless you're high risk for your visit, they're doing using the telehealth, you know, just calling on the phone updates. So it sounds to me like a lot of practices, they themselves are the physicians, thank goodness, the healthcare workers are working to protect themselves so they don't get the virus and then they can't spread that to other people. And I imagine some of that being because just about a week ago, actually, that's when they started really pushing face masks for everybody, not just the healthcare workers. So there seems to be, you know, like you said, changing all the time. So I know I use a face mask and gloves if I go out at all, which I don't.
I think nutritionists are doing similar things. We did a visit this morning with our pediatrician, and it was a telemed visit, and you know, it worked fine.
So a question for some that I mentioned jokingly about the potential 9-month, you know, baby boom. We'll see if that happens or doesn't. But would you recommend trying to conceive during the coronavirus? I don't mean for.
That's a great question. I would have to say that for myself and most working moms that I've talked to, conceiving is completely off the table right now. It's hard to balance working and having your kids at home all the time. So I think that's the last thing on a lot of people's minds. But, you know, everyone's situation is different. Some people have been working really hard to try to conceive prior to this. You know, some people have other concerns like age or healthcare issues and things like that that they have to take into consideration. So you just kind of have to make that decision for yourself with your doctor or midwife or whoever you
choose to work with. That's a good point. And I guess going back to the COVID-19 question, if, you know, heaven forbid, someone does have contract the coronavirus and they come in, will they be separated from their baby and the baby placed in quarantine? Are they themselves placed What are you hearing, or what are you seeing as far as?
That is currently the recommendation, and it's a very strong recommendation. I think there's a lot of liability there. Ultimately, as the patient, you get to make decisions for yourself and your baby. But right now, what most hospital systems are recommending is that if you were positive or suspected, even, I think you would go to a unit dedicated to caring for patients with COVID, and then your baby would go to the nursery. Those things are changing daily. I think that there's probably a contingency plan if someone totally refuses that. As a mom, I don't know that I would refuse what's being recommended. But,
Well, and you made a good point earlier that as far as we know, that breast milk is not, even if you had it, you could maybe still pump and at least provide that life-saving milk to them until
right.
you're able to do what you
And
need.
supply, I mean, ideally, a otherwise healthy person would recover from it and be able to go on to breastfeed your baby, so you can pump to protect your supply and then work on your latch when you're reunited with the baby.
That's a great point. Okay, so a question I know that I have, and I'm sure other soon to deliver moms have. We know that some hospitals are having to limit the support person, or the people, your family coming in. Obviously, we all ideally want to be able to give birth to our child, and then everybody gets to come in and meet the baby and cuddle and hold and hug and kiss. I think that has changed. Um, uh, if you are allowed even a support person at that point, you know, if are they allowed to leave and come back, or what are you all recommending right now?
So I've seen this working a couple ways at a few different hospitals. I know that they are trying to contact people that are scheduled for C-sections or scheduled to come in for a delivery for whatever reason, to prepare them that they get one support person, and they're not supposed to trade out support people. So whomever you designate as your support person, that's your support person the whole time. One hospital I work with, I know, is not allowing them to leave the room really at all, unless it's to go see the baby, and if the baby's in special care or something like that. But they don't even want them to leave to go get food. So they're providing a guest tray free of charge for them to encourage them to stay in the room. Another hospital is, allowing people to make short trips to go get food. But, I know people appreciate that freedom, but at the same time, every time you go and come back, you're exposing yourself to potential illness, and then you're bringing it back to your, the person that just had the baby, the staff, etc. So I would recommend going and, being prepared to stay until you discharge.
Well, that's good information. And so that kind of comes to another question that some people ask. They are expecting loved ones to fly in or drive in from wherever, and to, of course, grandmothers and fathers want to be there to meet the child, that's sort of understandably so. Would you even recommend that family prepare to travel in to see the baby and be there for the delivery?
So, unless that's your main person, your main support person, they're not going to be able to come in for the delivery. You get one person. So, I mean, if that's your person and that's the choice you make, you are allowed to make that choice if it's the best option for you. Flying specifically opens you up to so many people and so many potential carriers of COVID, I wouldn't make that choice. If your parents are older, they're more susceptible. So that's a tough call. I know some people, they don't have any other options, and that's the choice that they make. But if you have the choice, I would say hold off, until this improves. I don't know that it's going away, but hopefully it will improve.
Yeah. And this might be one of those where you have that conversation with your health provider too.
Yeah, absolutely.
They think is a good idea.
OB, or your pediatrician too. They have some skin in this game for sure.
That's a good point. Okay, so this kind of is still along the lines. If, and this is obviously my concern too, is if the support person, so to speak, that you work with you actually needs to stay home with the children and you have to go it alone as the delivering mother, how is the staff prepared to help be the support person, so to speak, and like that?
So we're seeing this a lot where people come in. I will say that we've always seen this a lot, where some people come in and they don't have a support person at all, but especially now, they don't have someone else to take care of the children that are left at home. So we're seeing significant others not come, they'll come for the delivery maybe, and then they don't come until it's time for mom and baby to discharge. But we are there to help. After a C-section, you can barely lift that baby out of the bassinet. So that's what our job is. That's what we're there for. And we're definitely prepared for that. And I will say, as a nurse on that side of it, I feel like without all the extra people there, we seem to have more time, or I don't want to speak for everyone. I feel like I have more time to really help my patients, connect with my patients without, the big crowds. So it's possible. It's not ideal, but it's possible for sure.
Yeah, I can see how that would, having that care and comfort there from the nursing staff will make a huge impact. So I guess after the baby's delivered and it's time to be discharged, you go. Are you hearing about how follow-up visits with your baby will be addressed and with the doctor?
Yeah. The way different offices are doing it are probably going to be different. But as far as I know, OBs and pediatricians are scheduling those visits at regular intervals. Some are, like you said earlier, and how I mentioned this morning, telehealth is becoming a more accepted option. I think insurances are starting to cover telehealth visits, which is good. But visits where, seeing each other in person is important, or visits where baby has vaccine scheduled. And that's a big one for the pediatricians. They definitely want you staying on track with that and coming in on time and not skipping those visits. And I will say we had a well visit last week or 2 weeks ago, and they had us wait in the car. We checked in by calling, we waited in the car, and they came and got us when they had an exam ready. And it worked well. There was no one in the office, and it went really fast.
Yeah, I can, I think my pediatrician is doing to keep everybody out of the office in their car, and especially if you have a fever.
Mm-hmm.
But so trying to protect everybody as much as they can. That's a great point. Well, my last question is, because thank you so much. You gave us a well-rounded, thorough explanation of different topics and things that we need to be aware of, where we are at this juncture, put it that way. I know for me, at least, to protect myself, and those around you, we're talking about pregnant women, but, friends and family that have pregnant women in their lives, they are at risk, and you want to take good care of them too. So Would you recommend that, pregnant women and those that are around pregnant women wash our hands with soap at least 20 seconds, wear the non-surgical face mask in public settings, wear the gloves, practice social distancing, put 6 feet between you, other things like that? Would those be recommendations that you would give, or anything else that you can think of?
Yeah.
That
The gloves are tricky. The gloves are tricky, definitely with the masks, and only going out for essential items, really social distancing, meaning if you don't live with them, kind of keep your distance, which is hard. We're social people. We want to see our friends and we want to, talk to our neighbors and things like that. But it's just hopefully for a short time so we can get past this. But the gloves, I want to go back to, they make you feel like you're protecting yourself. But if you're not washing your hands or changing your gloves in between touching different things, then you're not protecting yourself from anything, and you're not protecting someone else from anything. So don't think that just putting on a pair of gloves is going to fix anything.
That's a good. I put the gloves on if I do like picking up prescription medicine. I have to be the one that does it, whether I like it or not. I hate it.
Right.
I wear the gloves and then I think, but I just touched like 5 things. I'm not really sure that I'm not spreading anything, but that's a great
point. Yeah.
On the gloves or something.
So if you can find hand sanitizer, just, keep that on you, and in between interactions and touching things, use the hand sanitizer. But gloves are sneaky like that. They give you a false sense of security.
That's a good point. And the last thing, and I think you said this in the beginning, but you do have, you feel good about the PPE. We've heard a lot about the personal protection equipment not coming in, but you guys feel okay about it now, and you feel protected and on the job.
At this point, I think we're good. We have plenty, but that's changing every day with different circumstances. So I know there's a great group in town that's making masks and donating them to healthcare workers. So I have secured some for my team if or when the time comes that we don't have disposable masks at our fingertips. So we were prepared that way. But hopefully, if we can get past this, we can start replenishing our resources, because you don't think about how many times you're interacting with different people and using masks and gloves and gowns and things like that. So you use a lot of them, and not only are they expensive, but they're not, we don't have an endless supply. So we've got to pace ourselves. Right now we're here in South Carolina, as far as I know, but
that's good. Like you said, take them home and wash them. It's not that kind of thing. Well, we appreciate you joining us today. I really appreciate your time, because I know your time is very limited. You're working a lot, and you're out there caring for patients, and we appreciate it. And
of the front door.
Oh. You want to say hi?
hey. As we mentioned, Conni is she's not just a nurse, she's a mom as well. So that's why we have her on, because she understands what we're all going through as well. We'll Conni go.
Visit.
If we have any questions, from any viewers, maybe we can bring you back, or we can answer some of those questions. Sure. So,
I hope this. Well, I know it's a weird, strange time to be having a baby, but I don't want people to be nervous about it. We're keeping everyone safe. So far, so good, and we're ready for you.
Well, good. I'll be seeing you in like 8 weeks or so.
All right.
But thank you so much. We appreciate it, and hope you enjoy your day. And we might have to bring you back for updates. So
absolutely,
we've got time.
Stay.
Thank you.
Thanks.
Well, thank you for joining us today. I do plan to put all these videos on our YouTube channel, our Facebook page, and the answers to some of the questions on my website, which is allmomsneedhelp.com, because we all need help. But I do want this to be a viewer-driven, session. I want to hear from you, any topics that are of interest that you would like me to do the research and find decision makers and experts in a variety of fields. I'd be happy to do that. So please contact me either way for YouTube, any of the platforms I'm using, YouTube, Facebook, the website, and if you have any additional questions for Connie, we will certainly do our best to answer that. So. But until next time, stay safe, stay well, and be careful. Thank you.